I'm an anesthesiologist and I'm also board certified in chronic pain management. So we can come up with plans before you go to the OR, and then we actually execute those plans in the OR, and then we can help with pain after surgery's over. Chronic pain is really the pain that persists outside of the operative setting. I see patients who are young and also in their 8th and 9th decade of life, and it can really be anything from a post-operative patient who's still struggling despite being well healed and considered fully recovered from a surgical perspective, or it could be someone who really has no identifiable cause for their pain but is really plagued by some sort of daily agonizing condition which is inhibiting their ability to live a meaningful life. I will see patients with craniofacial pain, upper body pain, low back pain, and even pain kind of in the most obscure random places like the bilateral feet or the hands. I like the patient to characterize their pain in their own words, so really what it feels like and what words they would use to describe it, what things make it better or worse. I like to do a physical exam where I will try and do different maneuvers that may lead me to think it's more one cause versus another. And then we come up with a comprehensive plan together. I usually focus on non-opioid medication management. Depending on the person's specific pain complaint, we can offer anything from a simple injection with steroid into a particular joint that may be hurting them to more complex procedures that are still considered, I would say, non-operative. We also do procedures in the spine itself, so things like epidurals for maybe like chronic low back pain as an example. But I even see facial pain. That would be something very different depending on that patient. There are also more complex procedures that we offer as well if we're trying to exhaust conservative options before something like surgery, or in patients who've maybe already had surgery and still have pain, we can consider something like a spinal cord stimulator if that's appropriate. But it really is tailored to the specific patient. I think the most rewarding thing is when you have someone who really just has such high hopes, but their body has failed them, and then you figure out a way to tweak their care in the simplest of ways, and all of a sudden they're outliving their life again in a way that's meaningful for them.